Hello and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communications Service and Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communications Service, and I am your moderator for today and these sessions. Thank you very much for joining us. We have today with us, I'm so pleased that Dr. Jan Fizzell, a Senior Medical Advisor, is here again with us to give us our COVID-19 updates and health information. Hello, Jan.
Hi, Jess.
And we're very pleased as well to have with us Dr. Darren Roberts, Medical Director of the New South Wales Poisons Information Centre, to speak about the dangers of carbon monoxide this winter. He was with us last year and you're back again. Thank you so much.
Thanks very much, Jess.
Yes, and thank you. We'll have 30 minutes of discussion, but before we start, we'd like to acknowledge the traditional owners of the land from which we are all joining from today. Dr. Jan and Dr. Roberts and I are joining you from the land of the Camaragal people of the Eora Nation. We pay respects to elders past and present and extend that respect to Aboriginal colleagues and community members who are joining this session today. We also like to acknowledge the elders and leaders of multicultural communities and refugee groups who are joining us this afternoon. And we'd like to remind everyone and acknowledge that this week is Refugee Week. And we're so proud that a lot of resources and information are being targeted and available for refugee communities. Now, we will do our best to answer your questions. As I mentioned, we have 30 minutes, but we'd love for you to add your questions on the chat, and we would like a lively discussion. And my colleagues from the Multicultural Health Communication Service will be putting some links onto the chat for you to use for your communities. Now, we will start. Dr. Jan, how is COVID-19? How's the situation? And how are we coping?
Look, there's certainly a lot of COVID about at the moment. For example, I was at a camp with some kids on a weekend and we've already had 2 kids notified as having had COVID at that camp. So it's worthwhile remembering that COVID is definitely still with us, as are things such as flu and RSV, all caused by different viruses, but particularly in kids, they tend to present fairly similarly, with the kid not feeling very well, fevers and congestion. So the important thing is, of course, please keep your kids at home if they're not well. Make sure they're not visiting elderly, vulnerable family members. For older people, particularly people who got sick with COVID around Christmas, it's now 6 months since you last had COVID. So it's time to think about getting that booster if you'd been putting it off till you had that 6-month period, because your immunity from that infection around Christmas will now be waning. It's also really important, of course, for people to remember that if they are vulnerable to becoming more sick with COVID than most people who are immunosuppressed, people over the age of 55 with 2 or more illnesses, people over the age of 65, that there are COVID treatments available. You should talk to your GP, make a plan before you get sick, and that plan should also include your plan for testing. Because whilst a lot of COVID PCR testing centres are now closed, doctors can still order those PCR tests and tell you whether you've got COVID, flu, or some other nasty bug around. And also you can still pick up those free rat tests from a lot of community centres, libraries, community functions, but also from Service New South Wales centres. Just wander in and say, could I please have some rat tests?
Now, Dr. Jan, you said that 2 kids from the camp that you went to probably if you go to events like that, they probably didn't have symptoms. Is that correct? So they would have gone?
So, before the camp, we'd said to all the parents, please don't send your kids if they're sick. And, to be perfectly honest, camping on that weekend, most of us felt a bit under the weather. It was very, very cold. And so people were naturally tired. But the good thing those parents have done is told us about it afterwards so that we can inform everyone, so that people who say have a kid who's feeling a bit out of sorts, instead of just saying, oh, they went to a big camp on the weekend, know that they probably should be using one of those free rat tests and checking their child before they go to school.
Thank you, Dr. Jan. Now, this winter, as you mentioned, it's cold. And it is cold this winter, Dr. Roberts.
This last week, it's been very cold.
Very cold. And that's why we want to make people aware of the dangers of carbon monoxide. But before we ask questions for Dr. Roberts, let's watch this video.
Carbon monoxide poisoning is a killer. It occurs because people bring devices inside that should be outside, burning devices such as gas heaters or charcoal burners or barbecues.
In a controlled test, carbon monoxide began filling this room in minutes. It quickly reached dangerous levels.
The problem with carbon monoxide is that it has no smell, no colour, no taste. You don't know it's in the room. It's like a silent killer. You may not know you're breathing it until it's too late. Protect yourself and your family this winter. Leave barbecues and outdoor heaters outside. In the case of a medical emergency, please call 000.
That is scary.
It is scary. And
What-
yeah, we're talking about this because people are coming to harm. People could die from these products, and it worries us a lot. So we really want to make sure that people understand the risks of carbon monoxide, and that so many of us can be at risk.
Now, when a lot of the communities, especially those who may not know this, and a lot don't, that when you bring any normal barbecue is like, okay, well, it's hot. It's really hot and I need it inside and I'll just use it inside. What should we be reminding people?
So there's a few things we need to be careful of. There's a lot of devices that generate heat, which are only meant to be used outside, and that's because they produce carbon monoxide. And the devices we're worried about relates to barbecues, which we may be used for cooking. The other devices are those which are heating devices that are used outside, like those gas lamps that you can see. People are cold, and if you're not prepared for it, you don't have heaters, electricity is expensive, then people will do whatever they can to stay warm. But it's really very dangerous. These devices should not be used inside because they produce carbon monoxide, and carbon monoxide is very poisonous.
So Dr. Jan, what is the things that you and Dr. Roberts, what do you feel? Is it anything? It said there that you don't even know it's there. It's silent. It's no smell. What would you be feeling?
No smell, no taste, no color. You wouldn't even know it's there. Some people early on with carbon monoxide poisoning feel some headache. They feel a bit of nausea, feel like they want to be sick. They may have tummy pain. They may get dizzy as well. Some of the features, though, you could excuse for being other causes. So it's just very vague things, but it's very concerning, because if people continue to be exposed to carbon monoxide, then they can actually become unconscious and they can die. And this happens in many parts of the world. We haven't had any deaths recently in Australia, to my knowledge, but it's a major concern.
Dr. Jan, what should we be saying to communities, and especially there's a lot of messages we're doing, and here's another one. How can we make sure that we keep remembering these messages?
Look, I think it's a problem for all of us in Australia. We don't have houses that are built for this sort of cold that we've had. If you've come from overseas, and particularly if you've lived somewhere like Europe or North America, where you're used to having a house that's been built to put up with a long, cold winter, Australian houses aren't built that way. And so I think it's also understanding that people may need to get warm, but rather than putting on a heater or putting something from outside indoors, it really is about wrapping up warm. And so it is about, put on 3 layers instead of the one. It's what my husband is constantly telling me to keep our electric bill home is we don't need that heater on, Jan. What we actually need is to rug up. And that's also really quite true, particularly of older people, making sure that they've got adequate warmth, particularly if they're moving from a bedroom to a bathroom some distance away, because if they fall over, it can be a real problem for them if they lose their heat.
Yes, we'll go back to that, Dr. Jan, and we have some resources available on the New South Wales Health website on carbon monoxide, and they're available in multiple languages. And in the future, we're hoping to add more languages. But Dr. Jan, this is a serious thing. Remember when there was fire, and if there's heat, now it's winter. Check on people to make sure that they're well.
That's right. And that's the thing. It's about making sure we've got used to talking to our community when people were in isolation or anything else. I think it's really important that we also check in with people, can you stay warm? Because it is a real problem. And a lot of people do actually have up the top of their cupboard somewhere a couple of extra blankets that they can lend to family or friends if they need it. And so it's about, being a community and looking out for each other again, but also making sure that if you see someone doing something that's dangerous, if you see the barbecue inside, if you see the outdoor gas heater indoors, giving them the word that actually that's pretty dangerous and you shouldn't be doing that. How can I help you instead?
Thank you. Dr. Jan, why do carbon monoxide increase over winter? And why is this, What's the case? What's the
So
story?
we actually see carbon monoxide poisonings all year round in Australia, particularly in New South Wales. The main concern in winter is just that there's a change in what people do to try and stay warm. It gets colder, and if people aren't ready or prepared, then that's when they start to use these devices, which should be outside, inside. So that's why we often see the spike around this time, which is why it's great to be here now so we can talk about it, because carbon monoxide poisoning, the best way to keep people safe is to prevent the poisonings from occurring.
And so what we need to remind people, and if, we have the multicultural media online and health workers right here, we want to be sharing these messages to communities. And what should we be saying to the media and to that some people just have arrived in Australia. They don't know that this happens.
So I think the first thing that I've often told people who are family or friends coming from overseas is that you will be colder in an Australian house than you have been colder in a lot of places overseas that are very cold places. And that's simply because, as I say, we're not constructed well. We don't have, the sort of plumbed heating that a lot of places overseas have to keep people warm. So we do actually have a lot of different things that can go wrong. So we've got the outside heaters being used indoors, but also for kids with asthma and so on, when people are using gas heaters indoors, it's also important. The ones that are actually meant to be used indoors, it's still important to make sure that we have good ventilation around them, because if you keep them in an enclosed room without airflow, you can actually build up some of the tiny little particles of air pollution that can make people's asthma worse and make them feel sick as well. So it's a really difficult thing keeping warm in Australia when the electricity prices are so high. And so that's why it's about giving people the message, giving people spare blankets, making sure that they've rugged up warm, or encourage them to say, look, you may save a few dollars on the heating, but it could cost you your life if you're not going to use an electric heater.
What happens if you do have, someone does get poisoned? Where do? You said 000, but what will happen when they do call that number?
So the first thing is, if someone suspects that they or their family members may have poisoning, open every door, every window and get outside. That's the most important thing. If there's a burning device inside, I'd call the fire brigade and let them know so they can then come and remove it. If you have symptoms of possible poisoning, you can call the poison centre on 13 11 26. They're open 24/7. People there who are experts and trained will be able to provide advice. But in the case, as you just mentioned, of any medical emergency, if someone's unconscious, they're just not themselves, just call 000, because they need treatment immediately. All ambulances have treatment, which is just a oxygen via a mask. But so in an emergency, please dial 000. But otherwise, poison centre, always available.
And if a person is there, do not attempt to do anything in terms of medicating someone. What do you do?
So there's no medicines that will help you or treat carbon monoxide poisoning. The most important thing is to get oxygen via a mask straight away. So it's either by the ambulance or going to a hospital.
Now, if English is not my language, you can call TIS and call the New South Wales Poisons Information
That's
Centre.
right. We're well practiced at dealing with TIS. We love calls from TIS National because it helps everyone involved. So please call TIS National and they can put you through to the Poison Centre and assist.
Now, this is just a different topic. How can we share this information to our families and friends and ensuring that they're not, again, one of the most is getting them anxious and getting them worried. That this is another thing that I have to remember, and it's scary.
Yeah, I think the key thing is about making sure that we help family and friends who are coming to Australia or who we might see doing something, and just explaining to them what the danger is. Because I think, when you've got a silent killer like carbon monoxide, it's really difficult for people to conceptualize what's actually going on. And so I think it's really important that you've now got this information from this conference, you're reading this article in a newspaper, you're watching it on television, you're looking at the fact sheet. That's really powerful information that you can share with your community and just check in with them. And if you do see someone doing something that's dangerous, just explain what they're doing is dangerous and what they could do instead.
And Dr. Roberts, were there any, multicultural communities we're sharing this information for multicultural communities, just because it's something that's probably not in the news in most of the communities or in other countries.
That's right. So we've been paying close attention to the families, because this is often usually family groups, which in some ways makes it more tragic that a group are getting together to celebrate and spend time, and then it can end in tragic circumstances. We've been looking at family groups and cultural groups who've been poisoned to get a better idea in terms of how exactly to target the message. And we've got information sheets, I think, on 6 or 7 different languages. But we're very happy to hear if there's other languages as well where we should develop more, particularly if you think there may be a cultural association with the use of burning devices inside or something similar. Very happy to hear.
Please ask your questions in the chat. We have Dr. Darren Roberts, New South Wales Medical Director of New South Wales Poisons Information Centre, and this is really an important topic. And when I know from a lot of the communities, and I'm from a multicultural community myself, and I've never heard of this. And some of the languages that we've tackled, as you said, these are the ones that we've found some communities, but would that be the case in other communities around the local health districts as well?
So I think I don't know enough about the cultural determinants of some of these activities, but I've spent some time in the Middle East and I've heard many stories of people dying from similar sorts of events. So I think that this is an activity in some parts of people's home areas, home countries, and that's why I think we really need to talk about it. All of us are at risk. In New South Wales Poison Centre, we've noted cases from across New South Wales. There's a lot more in the southwest, which I think really just relates to populations. It doesn't mean that that's a particular area where it's cold or anything like that, but everyone is at risk. And that's just from heating devices. There's other reasons as well why people are at risk of carbon monoxide poisoning. Workers, people who are doing other sorts of activities which involve, for example, small generators, even people leaving their car running in the garage, you can be at risk of carbon monoxide poisoning. It's really a major issue.
Wow. That is, what kind of appliances should you be using, and what should you to reduce this risk?
So this relates more to people who are using devices for working purposes. So small generators, which may be attached to, for example, an electric saw, a fuel generated powered saw, or other sorts of devices. So generally they tend to be handymen or professional workmen who use those sorts of devices, and they use them inside and they don't have adequate ventilation. There's been some cases of people who have used a device which wasn't angled away from a window, and the fumes went inside and people felt unwell. There could be a few reasons for that. But again, it's a reminder, if you're using any device which has an exhaust, turn the exhaust so it's facing away from windows out into the outside, into the atmosphere.
And should you be considering installing a detector for carbon monoxide?
So it's a controversial topic because carbon monoxide detectors come with a cost. So it's the law in parts of Europe, for example, the UK. We don't have that law here in Australia, but I think if you have a gas-powered heating device in your house, you should get a carbon monoxide alarm fit. You should also get it checked every 2 years by a registered electrician, I'm not sure.
Gas fitter.
Gas fitter. Okay, right. A registered gas fitter to make sure that there's no problems in terms of the burning and any carbon monoxide being emitted.
Dr. Jan, this is, these are topics that should you be asking this to your doctor? Should you be asking about carbon monoxide? It's winter now. What should I be aware of? And should the doctors also be advising their patients?
Look, I think the key thing with talking to your doctor is that if you're noticing that you're getting headaches and nausea while you're indoors, when your doctor's talking to you about it, do think, hey, hang on, have I got a gas heater? Have I been bringing gas things indoors? Or if your child's asthma is playing up, but they're not particularly sick when they're in their bedroom, for example, but they do get wheezy or unwell when they're down in the main room with all the rest of the family and you've got a gas heater, it's a good chance that that gas heater is, provoking that asthma. So I think it's really important that we don't put everything down to having a gas heater, but that we are aware that, for a lot of people, that difference in having gas cooking, gas heating can be the difference between a person who's quite a brittle asthmatic feeling well and not feeling well. For a lot of people, it won't make a lot of difference as long as you keep some ventilation going where you're cooking, or, because I know how much I hate having windows open. I have a gas heater and, but we make sure that there's a flow, because if there's no flow going through, then I know that I'm at increased risk of feeling yucky and stuffy and not good. So it's really about making sure that you've got that flow, because as I said, Australian, especially older houses, I grew up with one heater in our house, and we all sort of used to cram around the one heat source and then run for the beds with hot water bottles, which are another scalding risk and all sorts of other problems as well. Isn't it good to live in the 21st century rather than the 20th century?
Growing up in Tasmania, it was freezing, one heater.
One heater. And, and
the electric blanket was invented.
Yeah, and this is still true for a lot of families today. There is often one place in the house that is warm, and so everyone is there. And because everyone's there, we might have closed the windows because somebody can't stand the draft, and then next thing we know, people are not feeling great and not feeling sick. So it's really important that, particularly if we're using gas and even some wood heaters as well, they don't always burn cleanly. People do wind up, particularly ones that aren't enclosed, ones that are open to the room, and these are the ones that have been correctly installed, not just a barbecue. It can be really, really difficult to be safe. So it's really worthwhile looking at that investment in your family's health, in using a cleaner form of energy, whether it's solar, electricity, which is nice if you can afford it, but not everyone can. But then going back to the good old traditional ways of what we used to do, which was to warm up and run.
Yes. Now you mentioned about the electric heater and the electric blanket.
Yeah.
There's no risk to that. Is it a silly question? I'm just asking. Is there no risk to that if it gets electric? There's no carbon monoxide in anything.
Right. So carbon monoxide only comes from devices that do burning.
Okay.
And it's when there's incomplete burning. So that's where it's the barbecues, which have charcoal, briquettes, wood, the outdoor gas lanterns, which are used for heating purposes, those sorts of devices that cause burning. The natural gas heaters that are inside the house use a natural gas. And if the machine's not working properly, then that's when you can get carbon monoxide coming through. So no, anything electricity is safe. Certainly the hot water bottle is safe, except as mentioned by Jan, scalding risk. Don't do it too hot.
Don't do it too hot. We have a question, from Warren. Hi, Darren. I agree with the approach for culturally and linguistically diverse communities that you mentioned. However, for many, it is the norm to bring heating inside. Many made worse if they have reduced capacity to remember not to, or dementia. Would you like to see a language-specific media saturation program implemented? This is from Warren.
Would you like to see a language?
Would you like to see a language-specific media saturation program implemented?
Well, I think New South Wales Health is actually leading this, and they're actually running paid commercials at the moment to areas and through channels where people who we think are at more risk are actually currently placed in an attempt to try and reach them. And I think that's also one of the reasons why we're here today, so we can bring attention, have the discussion, let people know about the resources by New South Wales Health. But I do agree with you, for many people, it is the norm. I remember being in Iran and seeing signs everywhere talking about the dangers of carbon monoxide poisoning, and hearing tragic stories of people celebrating a wedding, taking burning devices inside, and tragically people dying. So there are issues with this, and some people may not be aware of it, and it might have been part of their upbringing. But this is why we're here, just to let you know that this is not safe, ever.
Now, we'll take on your questions. Please put them in the chat. I just wanted to talk about influenza because it's winter, carbon monoxide, and then there's influenza that comes around. I also wanted to ask this, and we'll go to that. But could you have, for example, you put it in, you take it out, then you get a bit of poisoning, and then it doesn't really affect you so much, and you do it gradually. Could that be happening? For example, you put the heater just for a few minutes, take it out, like the barbecue, and take it out. Would you be accumulating that poison over time?
So
if you don't do it, if you're just doing it bits and pieces?
Yeah. So the effect of carbon monoxide is determined by a few ways. Number one, it relates to how high the concentration is in what you breathe in, how long you're breathing it in. And then once you get away from the carbon monoxide, how much time you give your body to recover from that. So there's so many factors that vary within that. My advice would be not to try and guess, and not to try and think of a safe way to do it. For example, I'll just bring it in for a certain amount of time and then take it out. I just think it's always bad and it's always dangerous. There's just too much risk. The other thing that we know is that there are some people who get permanent damage. And so lots of small exposures might potentially increase the risk of that. We don't know. I just think it's too dangerous.
Thank you, Dr. Jan. If someone is sick with the flu, with COVID, and they're cold, that could be something to be thinking about.
Yeah, and I think that's the thing, isn't it? It's about when we're, one of the good ways to spread flu and colds is that exact activity I was just talking about, where we all huddled in the one room together, very closely together. And you might remember when we were talking about COVID a lot, we talked about, leaving a bit of a window open and getting that airflow through. And it's still just as important this winter, whether you've got a gas heater or not. Keeping that ventilation going makes a difference to the air quality in the room and makes it less likely that you'll transmit viruses. But if you are feeling cold, it is one of those, just steal all the blankets off everyone else temporarily and just stay warm. And once everyone else is home, you can talk to them about who gets which blankets. I remember some very serious negotiations in my household over the years as to who got which doona, which was fluffier. And I'm sure that happens in lots of other families as well. But when somebody's unwell, making sure that they're comfortable. You don't want them to overheat is the other thing, but just making sure that they're comfortable and warm is important, and keeping their fluids up.
And just a reminder that influenza is around.
It certainly is. And if you haven't had your free flu shot, you really should. We have had flu around. It's been a pretty nasty year from a respiratory virus point of view this winter so far. And I'd expect with this cold snap driving more people indoors than previously, it could get worse. So I think it's really important that even if COVID goes down or flu goes down, we've still got lots of viruses around. And if you're a vulnerable older person, any of those viruses can do you damage. So it is just important that we keep looking after each other. But if you're not up to date with your COVID and flu shots, and even for older people, their pneumococcal vaccination, which helps prevent pneumonia and other diseases from the pneumococcal bacteria. Talk to your GP. I know when my mum went in to see her GP, the GP didn't almost just give my mother her flu shot, but she tried to get my sister and I as well. I was already done. But, it's good to see your GP, and those GPs are really looking after us. So if it's time for you to check in with your GP, get your script sorted, talk to them about your pneumococcal vaccine status. Is it time for a booster, your flu and your COVID?
Thank you, Dr. Jan. We have a comment here from Min MCD. Tragically, electric blankets and heaters are also at risk at winter and often the cause of house fires. Knowing your risk and taking preventative action is key to protecting yourself and your loved ones. And winter safety checklist is here at the www.fire.nsw.gov.au/winter. And that is important. Every time there's a change of season, we should be aware.
Because a lot of our equipment wears out. And that's one of the things that can happen with electric blankets, can certainly happen with electric heaters. And the other thing that happens is when we first buy a device, they've often got instructions with them, and we read them once and then we chuck them. And then when we get that same device out 3 years later, we don't have those instructions anymore. But they're often the instructions that tell us not to block a particular outlet, because when we block a particular outlet, it means that there's a fire risk, particularly if we hang clothes over heaters that shouldn't have clothes hanging over them, or we hang the wrong fabric over a heater that can melt and burn at a lower temperature. So there's lots of reasons to keep the instructions when you buy an electrical appliance, whether it's a heater, a fan, or whatever, because when we don't use them correctly, as per the instructions, the risk of having fires or other dangers goes up dramatically.
Thank you. And Dr. Roberts, I was just reading that the symptoms could be seizures of carbon monoxide, and that could be, a lot of people could think that this is not even carbon monoxide, that this is just something that's more serious, but it is serious.
It is. So people who get seizures have had a very high exposure. Often they've been a bit sleepy beforehand as well, but you've got the heater on overnight, you'd be sleepy as well. You wouldn't necessarily pick up about seizures. So I think whenever there's a change in health, it's always useful to reflect on, have I done anything differently recently? And here we're talking about carbon monoxide poisoning, to have attention to that as a possible cause. But you're exactly right. There's a lot of people who have a seizure, and it'd be good to understand why.
Yes. So Dr. Jan, would it be best, as I said, just to double check when they go to the GP, to always be aware, making sure what they've done and tell the GP what's been going on with their daily lives, and that's been a change.
Or it could be that you've got a friend or a relative who isn't listening to you when you're giving them this good advice. If you're taking them to the GP and you're in on that consultation, you might ask the GP, what do you think about bringing these types of things indoors? And that way you can have some support from your GP or your pharmacist or your trusted health professional to reinforce this advice, because this is standard advice around the world. We're not doing anything dramatically different here in New South Wales. It's really important that, you know, if they're not believing you as a citizen and someone who cares for them, or a relative and someone who cares for them, get the health professionals involved. They will tell them exactly the same things.
Thank you. We've run out of time, but thank you so much for joining us. But any last words, Dr. Roberts, to the media and to the health workers and community online today? Keep
burning devices outside. Carbon monoxide is a silent killer. Protect your family. And call the Poison Centre on 13 11 26 with any questions, unless it's a medical emergency, in which case always call 000.
And if you need language support, call TIS 131450 and ask for the New South Wales Poisons Information Centre. And thank you so much, Dr. Roberts, for being here. And Dr. Jan, any last words?
Just if you're unwell, if your family members are unwell, please stay home. Please don't spread your germs. And as Dr. Roberts has said, keep hot things that shouldn't be inside, outside.
Stay warm this winter. Keep up to date with your vaccination.
Yes.
And keep those burners outside, and stay safe, and check with your doctor for any questions. I think that's advice. Thank you so much, everyone, for joining us. If you have any questions, please put them on the chat, or give us an email, and we'll feed them to the experts and get back to you. And if you want more information and other topics, please let us know. This recording will be available on the New South Wales Multicultural Health Communication Service website, and we'll send them through to you so that you can share them on your publications for your communities. Thank you for joining us. Stay safe.